PSCI: reduce cost, improve outcomes, improve patient experience.
In the building process, it became important to have the right resources in-house. So we hired some nurses. We had a director who would lead the patient-centered medical home project. We had a pilot that we started out with Cigna. So we had support from Cigna, and we had limited data. Now what we were wanting to do is really try to understand where those risks and where those gaps in care were. But before we could really operationalize a lot of this, we really had to spend some time working with the physicians. So we spent one of our retreats, we have an annual retreat, taking the physicians away and really doing a complete overview of what patient population management, patient-centered medical home meant. And that was really to get the physicians comfortable with the ways that we were going to be capturing data and the way we were going to be measuring and presenting it back to them. And that was a process that took about a year of staying on message, not wavering, and basically thinking that this was just something that, as I think I've mentioned before, wasn't a fad. The physicians are very sensitive to the fact that there's a lot of changes being put upon them and that they really don't want to waste their time, or they don't want to go down an avenue and find out that that was last year's and this year we have something different. So it was important that we be consistent, that we stay on message, and that we do as much education as we could in a group setting and also one-on-one, so that we were able to talk to the physicians directly every time they had a concern. Every time we presented data to the physicians, we gave them the opportunity to challenge the data and tell us what they thought was wrong with it. So that bit by bit we were able to consistently work away at all the concerns so that we had everybody on board with this new process.